choose, because of whatever reason, to abuse certain substances. That doesn't make necessarily the substance bad or evil or whatever. Some substances, yes,
they are bad.
They are bad, right? But
yes.
others, like it's a lack of education, I think, on our part.
Yes.
And I say our part because, like, I have in the past been just as guilty, right? Of understanding stuff, especially when I started taking TRT and stuff like that, understanding that and then not telling friends about it. You know what I mean? Kind of because of the stigma, not wanting to, whatever.
Sure.
And like now I change my mindset on that, and I'm like, I'm going to tell everybody about this. If they don't want to take it, that's their business, you know what I mean? But like, if there's a chance that they can live a better life,
why not share?
You know what I mean? Yeah. Why am I?
Because it's their choice.
Why
am I holding back information?
Right. It doesn't make any sense, And so, I think that's one of my first and foremost, one of my biggest recommendations, male or female.
Sure.
Get your levels checked.
Absolutely.
Like, get your hormone levels checked, and also understand that if you go to a regular doctor and they say it's within range, what that actually means.
Yes.
And it's not within a good range. No. It's within like
a range
of like,
it's an arbitrary range
of where we're at now societally. And
which is sick.
It's insane.
Which is sick, mostly sick. Right, a lot of sick people.
Right. Because if you look at, for instance, testosterone, if you look at the levels that exist normally now for a 20-something-year-old man, right? It's the same as like a 60-year-old man would have been, 50, 60 years ago.
Correct.
It's just dramatic decline.
It's changed. Even the range I'm finding where patients have gotten tested, depending on where they get their labs tested from, the range differs.
Yep.
And even within that specific facility where they get a check from, it has changed within 3 months.
Yep.
And I'm seeing and I'm going, not only is it changing wider, the numbers actually have gotten lower.
Yep.
So what it means to me, what I understand it as, whoever is controlling, and we both know who's controlling care, would be, they're withholding care. So they're manipulating the numbers so as not to cover care for these patients without that consideration of, we're actually putting patients at risk because of their deficiency with testosterone. Yeah. So yes, they're weaker, they're sickly, they don't, more depressive symptoms and all that. And depression is a symptom. But in any case, ultimately making that person a regular in the healthcare system of, you are depressed, take this. You are obese, take this, without getting down to the root cause of, let's just check your foundation.
Right.
Let's sit down and have a conversation about what your life is really like.
Let's see if the hormones that literally run everything in your body are in check and operating the way they're supposed to. It's kind of weird.
Yes.
And even back to the stigma thing, like, I think that's, if you say testosterone, people automatically think men who go to the gym or work out, all that stuff. That's not
the case. No, like, not the case.
Women need it.
Women need it, yes.
Guys that don't go to the gym
need it.
Still need it.
Yes.
You need to have a certain level. And I think one of the big learning curves for me was like, it's not necessarily about a number. For me, it's about how I feel.
Correct.
It's not, and it's not just how I feel in the gym. It's how I feel every day.
Yes.
It's how it's my mental up and downs.
Is it your zest for life?
It's everything. It's and like, so how are you gonna assign? Because I think like my level that I'm at now is probably a lot higher than my number, right? Than what most people would think is like a normal range. But that's where I feel the best. Right?
Yes.
And it's where I feel the best, and I'm also not getting the negative side effects of, this, that, the other thing.
Sure.
So does that mean that somebody is not going to feel that same way with a much lower number? No.
No.
So the number's kind of arbitrary to a point,
Very,
right?
very
So
much
why am I withholding care?
Sure.
Because you're only at some number that's within range.
Yes.
So that is another reason why the whole thing doesn't make sense, you know? So, you know, I really do, like, I recommend to anybody, like, get your damn levels checked and talk to somebody that knows what the hell they're talking about. And sadly, most medical doctors, when it comes to this kind of stuff, they just don't. It's not that there might be a more nefarious reason, but I think at the end of the day, I think it's a lack of education. I think that they're not trained on this stuff, and they're not told about this stuff, right?
Sure.
And so it creates a huge problem, you know, and
absolutely.
then, you know, like especially for, you have some, you know, there's some ego-based peptides as well, right? So like if I had some thinning hair and wanted to regrow my hair.
Oh yeah, sure, we can fix that.
Right. So
sure, we can help with that.
And that's all well and good. There's nothing wrong with that. You know
no,
what I mean?
There is nothing.
But it's, you know, at the end of the day, now could that boost my self-esteem? Cool. Yes.
Yes.
You know, but and but at the end of the day, I'm not going to live or die, you know, based on that,
yes,
right?
correct.
But especially when you talk about the healing stuff, like so the BPC 157 and some, you know, and like different growth hormones stacked on top of that, all this other stuff.
Yeah.
You know, so you take somebody not in an extreme condition like me, right? So you just take a fictitious person that has a knee problem, whatever, right?
Yes.
So maybe we're in decent shape, or at least not morbidly obese, whatever.
Sure.
And for whatever reason, they developed a knee problem, right?
Okay.
They go to the doctor doesn't know what it is. They take an MRI or X-ray or whatever, nothing shows up.
Actually, there's nothing.
Right. So what's going to happen? So you have path A, right? That, okay, doctor, what do I need to do? Well, take this medication and it's going to help you with it's going to help you with the pain. Yeah, or you go to physical therapy or whatever, right?
Yes.
So that path, I think most of us can clearly see that path ends up in this place where you are depressed, you're overweight, you still have the damn knee problem, right? And your life is now centered around that knee problem and what it has caused, right? And you can't go out and do the things that you want to do, right? And then so you have path B to where you say, hey, Alvear, I have this knee problem. And you're like, all right, well, let's try some BPC 157 and some Semarelin. And then you come back 2 months later and you're like, oh, holy shit, my knee healed itself. It's fine now.
Yes, now I can.
And now where does path B end up?
It's an alternate reality, isn't it?
It's a completely different world, right?
Yes.
Because now you're not depressed, you're not overweight, necessarily, unless you choose to be, right? For some other reason, but not because of the knee.
Not because of the knee. You can't blame the knee now.
Right. Because you can actually heal your body.
Correct.
And not just mask the symptoms.
The symptoms, correct.
And this to me is like, to get people to understand that there's a complete difference in taking a medication or an injection to dilute pain, to mask a symptom, to any of this stuff, and actually healing what the hell is wrong with that thing. Because
your body is capable.
Right.
I mean, without peptides, I'm sure you would have healed. I'm sure you would have healed.
Eventually.
And that's the case is how long?
Yeah.
Because most of the time, with any surgery you undergo, usually you're told in a year. Give us a year.
Yeah.
And even with that year, maybe not. Nobody can tell you exactly because you're different. You're N of one. You're your own. You're the own subject matter of this specific.
Yeah. Well, and as you age, those healing properties decrease.
And so
you know what I mean? You don't heal as fast.
Right. And can you imagine somebody who was not optimized on TRT undergoing the same injury?
Right.
How?
Well, and on top of that, like we were talking about earlier, on top of that, somebody that doesn't have necessarily my background and training and all that other stuff, and is able to kind of like mentally push themselves through that.
Sure.
Right? Because it's even with all that stuff, there's been times where it's been very difficult mentally
For you, yeah.
to just keep going and be like, okay, man, just one more day, just one more day, just one more day.
Sure.
And so somebody that doesn't have my background and hasn't developed those skills,
yes,
right?
Would be easier.
Without, you start taking all that away. Yeah, it would be very easily within that time, whether it's, 6, 9, 12 months.
It's a long time.
To get depressed, to just not care anymore. To just accept that this is my life now. This is what I have to deal with, and then basically just stop, right? Just stop living, right? And then especially with older people, that gets exacerbated. It's like, it's just.
I mean, pain management.
It would be different if this stuff didn't exist.
Yes.
You know what I mean? It would be different if the world we lived in, this stuff didn't exist.
Yes.
And it was like, okay, well, we just got to deal with what we got. We got to manage the pain, all this other stuff. But the fact that it does exist,
yes,
and the fact that it's not being talked about and it's not being pushed by doctors is kind of insane to me, honestly. It really is. Like every single doctor, even after I started doing, every single doctor that I talked to about this stuff, it wasn't as if, it was like they didn't know about it.
Yeah, it's not.
It was like, they were like, well,
what are peptides?
I guess you could try that, see what it does. I'm like, I feel like as having anything to do with medical stuff, right? If there's things out there that can heal the body,
yes, exactly,
then it might make sense for you to know about it, right?
Sure.
At least a little bit. At least have heard of it.
Sure.
But it's not being talked about, and so I think.
And is it just because of where we live? I mean, are we that far behind?
I think maybe you might see a little bit more in
metropolitan areas. Yep, I agree.
But I think it is. I think it's just it's a part of our society that I think is eventually going to get fixed. It's moving in that direction to where we're starting to do things differently.
Yes, I agree.
And it's a breath of fresh air.
It is
to me. But I think, like I said, I think eventually, like this will be mainstream. It'll be. You'll go into the doctor's office with a bum knee, and they'll be like, "All right, well, let's put you on some peptides and see how it heals up."
Yes. Yeah.
And you come back, a month later, and you're like, "I'm all good, doc.
Right.
Ready to go run marathons." And you're like, "Sweet.
Right.
Awesome. Go live your life, bro." Like why is that hard?
Yes.
But I think there's a whole lot of other people and things at play that don't want that. You know what I mean? And I think people are starting to wake up to that and understand that, these big pharmaceutical companies and all this other stuff, like they don't want you healed.
No, because you're a repeat customer.
Right. You don't make money, man.
No.
How? It's like, why
surgery makes so much money. You think about orthopedic surgery makes so much money.
Alvear, I don't know if I've told you this. So all said and done.
Yes.
Right. So like I'm covered by the VA. I didn't have to pay a dime out of pocket.
Sure.
All said and done.
Yes.
So we received all the bills of what they charged insurance.
Yes.
Well over $1 million.
One person.
Well over $1 million.
One person.
Yes.
One.
Yes.
Wow. Really? And that's without rehab.
Yeah. Well.
That was just for the 2 weeks?
Yep.
2 weeks surgery.
2 weeks in the hospital.
Yes.
3, 4 surgeries. Yep.
One person.
Yep.
One